This medication, Junel Fe 24, is a combination hormone pill that helps prevent pregnancy. It contains two hormones, norethindrone and ethinyl estradiol. The pill pack also includes 4 inactive pills during the 4th week, which contain a small amount of iron. These inactive pills are meant to help you stay in the habit of taking a pill every day, but they do not contain any hormones. In addition to preventing pregnancy, Junel Fe 24 can help make your periods more regular, reduce blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that this medication does not protect against sexually transmitted diseases. When taking Junel Fe 24, it's crucial to follow your healthcare provider's instructions and take one pill at the same time every day. Before you start taking Junel Fe 24, make sure to read the patient information leaflet provided by your pharmacist. It contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable pill, chew and swallow one pill every day. Some brands may also be swallowed whole. Some brands should be taken with water while others should be taken without water. Carefully follow the manufacturer's directions for your brand. Continue taking this medication exactly as prescribed by your doctor. Follow the package instructions to find the first pill, start with the first pill in the pack, and take them in the correct order. Do not skip any doses. Taking this medication after your evening meal or at bedtime may help if you have any stomach upset or nausea with the medication. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Your pill pack contains 24 pills with active medication and 4 reminder pills with iron. Take one active pill, with hormones, once daily for 24 days in a row. Take one inactive pill, with iron, once daily for 4 days in a row after you have taken the last active pill unless otherwise directed by your doctor. You should have your period during the 4th week of the pack, within 3 days after the last active pill. After you have taken the last iron pill in the pack, start a new pack the next day even if your period is continuing or if you do not have your period. If you do not get your period, consult your doctor. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first pill in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. Use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Side effects of Junel Fe May 24 include nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. You may also experience vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If any of these effects persist or worsen, contact your doctor. This medication may raise your blood pressure, so it's important to monitor it regularly and inform your doctor of any high results. Serious side effects may include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes/skin. In rare cases, this medication may cause serious problems from blood clots, such as deep vein thrombosis, heart attack, pulmonary embolism, or stroke. Seek immediate medical attention if you experience symptoms such as chest/jaw/left arm pain, sudden dizziness/fainting, or sudden shortness of breath. If you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you experience any other effects not listed. Junel Fe 24 is a medication that should not be used by those who smoke cigarettes or use tobacco and are over 35 years old. This is because smoking can increase the risk of stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. The risk of these serious problems increases with age and the number of cigarettes smoked, so it's important to avoid smoking or using tobacco while taking this medication. It's also important to keep this medication out of reach of children, as accidental overdose of iron-containing products can be harmful, and even fatal, especially for children younger than 6 years old. If an overdose does occur, it's important to seek medical help immediately or call a poison control center. When taking Junel Fe 24, it's important to follow the daily dosage as prescribed by your healthcare provider. It's also important to take it at the same time every day to ensure its effectiveness. Be sure to talk to your healthcare provider about the best time to take this medication for your specific needs and concerns. Before taking Junel Fe 24, make sure to inform your doctor or pharmacist if you are allergic to ethinyl, estradiol, norethindrone, or ferrous fumarate, or any other estrogens, progestins, or iron products. Also discuss any medical history of blood clots, high blood pressure, diabetes, heart problems, liver or kidney disease, or if you are nearsighted or wear contact lenses. If you have diabetes, be sure to monitor your blood sugar regularly and let your doctor know if you experience symptoms of high blood sugar. Also, inform your doctor if you have had or will be having surgery, as this medication may increase the risk of blood clots. It's important to protect your skin from the sun while taking this medication, as it may cause dark areas to develop. Additionally, if you are nearsighted or wear contact lenses, monitor any vision problems that may occur. After stopping birth control pills, it may take longer for you to become pregnant, so consult your doctor if you have concerns. Junel Fe 24 should not be used during pregnancy, and may also decrease breast milk production, so be sure to consult your doctor if you are breastfeeding. It's important to be aware of potential drug interactions that may affect how Junel Fe 24 works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products. Share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Junel Fe 24 include aromatase inhibitors, fezolinetant, aspemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. There are also some drugs that may cause hormonal birth control to be less effective, resulting in a potential risk of pregnancy. These drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, HIV drugs, and others. It's important to inform your doctor when starting any new drug and discuss whether you should use additional reliable birth control. Additionally, Junel Fe may 24 interfere with certain lab tests, potentially causing false test results. Make sure to inform lab personnel and all your doctors that you are using this medication. Always follow your doctor's recommendations and consult with them if you have any concerns about the effectiveness of your birth control. If someone has taken too much Junel Fe 24 and is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important not to share Junel Fe 24 with others. Make sure to have regular complete physical exams, which include lab and/or medical tests like blood pressure, breast exam, pelvic exam, and pap smear while taking this medication. Follow your doctor's instructions for examining your breasts and report any lumps right away. Keep all medical and lab appointments. It's best to consult your doctor for more details on the benefits, daily dosage, and optimal timing for taking this medication. If you miss a dose of Junel Fe 24, refer to the product package information for instructions on what to do. It's important to use backup birth control, such as condoms or spermicide, to prevent pregnancy if you miss a dose. If you have any questions, make sure to ask your doctor or pharmacist. If you find that you frequently forget to take your pills as directed, it's a good idea to talk to your doctor about potentially switching to a different form of birth control. This can help ensure that you are effectively preventing pregnancy. It's important to store Junel Fe 24 at room temperature and away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.